Hi there, this is Denise Wagstaff, and I'm a speech-language pathologist, and I've been practicing for over 25 years helping parents maximize their children's communicative potential. I'm going to speak to you today a little bit about some basics when it comes to speech and language. I'm going to define the two of them for you. So grab yourself a paper and a pencil and jot down some of these notes. I'm going to give you some news that you can use. So let's start off. We're going to talk about speech and language. All right? Speech has to do with sounds, the sounds that are in the words that we say, okay? So as children are developing, of course, you'll notice some kids have a hard time with certain sounds, and that's normal. When we see a child developing, it's hard for them to get their mouth to make certain sounds. They're a little bit more difficult. And as they progress, we expect to see them saying certain sounds that they should say at their specific age. If a child is having a hard time with a speech sound, you'll notice maybe they might say tat for cat, or dod for dog. That's a speech issue. There are some other particulars around that I could go into, but we can talk about that another time. But right now, let's just kind of keep it simple and think of speech as the sounds in the words that we say. All right? Now let's move on to language. Language has two components, two parts. We talk about the receptive language, which is what you receive. That's how I help parents to remember the differences. Think of receiving, receptive. That's the language that you understand. Okay, so if a child is doing all right with their receptive language, they would be understanding what you would expect them to understand for their age. All right, so if you said, go get the ball and put it under the table, they would be able to follow through with that two-step direction if they're understanding the language that's being presented to them and they're at the appropriate age for that. The other side of language has to do with the expressive end, okay? Just as you might think when you hear expressive language has to do with how we make our wants and needs known to other people. So, if a child is having an expressive language issue, you might see that maybe they don't know as many words, they don't say as many words as you think they should. They might know them receptively, but you might not be seeing them expressively, okay? So that would be vocabulary. Or you might notice that their grammar is a little bit out of order or missing certain pieces that you think should be there by their age. Maybe they're not saying a plural S, or they're not putting that ing ending on some of the words, or their word order is a little bit mixed up. That would be indicative of an expressive language issue. So think of these different areas, speech and then language with receptive and expressive, as separate entities, although you can definitely have issues that hit on both areas, speech and language. That's something, if you have concerns about that, you should definitely ask about. We want to make sure that our children are really getting everything that they need, and early work if that's a concern. So what you can do, one little tip, a little strategy, a little kind of test thing that you can do, is you can look at checking into your little one's receptive language. And you can do that by giving some direction, but don't give any gesture, and don't have any context around the situation that's going to give the child cues as to what the words are that you're saying, what they're meaning. For example, I've had many children, they'll be in a daycare setting and or even at home, and parent will say, oh, they understand everything that I say to them. And oftentimes parents are dead on. They're really good with knowing their kids, right? For sure. I'm a mom too, so I get that. Nobody knows your child better than you. But they may not realize all of the other cues that they're giving the child, and that's why they're able to understand so well. Maybe they're not relying on the language, but they're relying on the context and the gestures. So let's say we typically leave in the morning to go to play group. Maybe there's an event that we're going to, and the child knows the typical sequence of events. Mom will go to the closet, get her shoes out, and she might say to Jimmy, Jimmy, get your bag, or Jimmy, get your shoes on. And maybe Jimmy's not really clear about the language, but he sees Mom by the closet. He sees Mom get her shoes out. He sees Mom getting their jackets out. All of these cues are nonverbal, and the gestures, maybe she points over to the door, or she points over to where his shoes were, maybe at the back door or something like that. So those kinds of gestures will give a lot of information, and sometimes a child will rely on that and not necessarily the language. So if you want to see how your little one is doing, give them, not language that is close to where they should be for their age, and don't give them any gestures. Don't give them any little cues or context information that would give the meaning away of the language that you're saying. See if they're able to follow through. See if they know when you just use the words and don't use any gestures if they can follow through. So anyway, give that a go. If you have any questions, you can always reach me at speechie.keen@gmail.com. And I look forward to the next time chatting with you and giving you some more news that you can use. Thanks for listening. All the best. Bye.